Hello everyone, thanks for joining us. In our recent article, we made an analysis of the Tertiary Hospital Development Fund Bill 2021. Globally, tertiary healthcare institutions are considered as hospitals with state-of-the-art infrastructure built for investigation, breakthrough medical research, and treatment of complex medical ailments. Although this is the norm globally, tertiary institutions in Nigeria have unfortunately been unable to meet up these standards due to long-standing challenges such as poor infrastructure, inadequate funding, weak policymaking and implementation, amongst other factors faced by the health sector in Nigeria. For instance, only about 4.3% of Nigeria's 2021 budget is appropriated to the Federal Ministry of Health, which is just not sufficient as to provide quality health services to millions of Nigerians. This budgetary allocation for the health sector typically accounts for less than 1% of Nigeria's gross domestic product. The domino effect of all these shortfalls leads to the inevitable geographic inequality, leaving some regions with next to no healthcare facilities, poor motivation and remuneration for healthcare workers, mass migration of healthcare workers out of Nigeria, and poor and inadequate infrastructure to carry out advanced research or treat deadly illnesses. In an effort to address these issues and the overall current state of the Nigerian tertiary health sector, the Senate of the Federal Republic of Nigeria passed the Tertiary Hospital Development Fund Bill on the 5th of October 2021 for the rehabilitation, restoration and consolidation of tertiary healthcare in Nigeria. This takes the form of an earmarked tax, which is not a recent development within the Nigerian tax landscape. And this bill, if it becomes an act, will add to the already existing numerous earmarked taxes currently in force. Now, earmarked taxes are any dedicated taxes that are introduced by the government to generate revenue for a specific program, project, or sector of the economy. Typically, earmarked taxes are introduced and imposed to provide special funding to address challenges in a particular sector of the economy or to develop that sector. Examples of earmarked taxes include the Police Special Trust Fund Levy, which is imposed at 0.005% of the net profit of companies operating in Nigeria. The Tertiary Education Tax, which is imposed at 2% of a company's assessable profits. The Nigerian Social Insurance Trust Fund Levy, which is computed at 1% of the total emoluments of employees. National Information Technology Development Levy, which is imposed at 1% of the profits before tax of companies with a turnover of 100 million naira and above, and the National Agency for Science and Engineering Infrastructure Levy, which is imposed at 0.25% of the turnover of companies with a turnover of 100 million naira and above. The Tertiary Hospital Development Fund Bill will be funded through a take-off grant, which will be provided by the federal government. Money will be appropriated by the National Assembly, and certain organizations or companies will be liable to pay specified taxes. As stated in the bill, these organizations will be taxed as such. 1% of petroleum companies' tax paid on total barrels of crude oil produced yearly, 1% of mobile phone services providers' tax paid on airtime and data sold yearly, 1% of beverages and breweries companies' tax paid on profit yearly declared, 1% of cement companies' tax paid on profit yearly declared, 1% of paint and chemical manufacturing companies' tax paid on profit yearly declared, and 1% of tobacco companies' tax paid on profit yearly declared. In summary, upstream oil and gas companies, telecommunication service companies, paint and chemical products manufacturers, beverage production and breweries companies, and tobacco and cement manufacturers will be required to pay these stipulated earmarked taxes. Failure to comply will, upon conviction, attract a fine not exceeding 2 million naira or imprisonment for a term of 2 years or both. For the assessment, collection, and administration of the taxes, the bill has empowered the FIRS to assess and collect the taxes imposed. In this feat, the FIRS is required to assess and collect the resultant taxes in the same accounting period in which the affected companies are assessed to CIT, bearing resemblance to the manner in which tertiary education tax is assessed. A governing board will be established for the purpose of administering, monitoring and managing the fund, consisting of 14 experienced professionals in relevant government parastatals, ministries, medical organizations and others across the country. This board will be responsible for oversight roles with respect to the administration and disbursement of the money in the fund to tertiary hospitals for teaching, learning, research, service, training and so the question becomes whether additional earmarked taxes are the way to go. The healthcare sector of most countries is funded through a combination of budgetary allocation from tax revenue and other sources, earmarked taxes, and payments to health maintenance organizations from companies and private individuals. The initiative presented by the bill as a dedicated source of funding is commendable and likely generally accepted, given the potential for development and upgrade of our existing facilities through judicious use of the fund, transparency, accountability, and reduction of any exorbitant expenditure. However, the potential addition of yet another tax will further compound the financial burden of companies doing business in Nigeria unless these taxes are treated as tax deductible or as a tax incentive. This bill may also be viewed as contrary to the government's efforts in reducing the cost of doing business in Nigeria, which is high enough to have caused a number of large corporations to move their operations out of Nigeria. The increasing multiplicity of taxes in Nigeria may negatively impact the performance of affected businesses and the attraction of essential foreign investment into Nigeria. The private sector most definitely has a major role to play in revamping critical infrastructure such as healthcare. However, introducing specific taxes need not be the default option for the federal government. The private sector can mobilize the funding required for investment in healthcare through appropriate public-private partnership structures on mutually beneficial terms. To read more about our article, please visit our website and subscribe using the button below. Thank you.